Hi, my name is Olga. I'm going to be performing the skills video of the NG tubing insertion. So the supplies that are needed for this is the gastro tube here. We need our syringe, 20 to 60 milliliters with the extension here. Pen light, we need our tape, we need our gloves. We also need the drape for draping the patient. We need our test strips, and then we need tape. Also, we need our lubricant jello to lubricate the tip of the NG tube. And then we need our tub with warm water. Next, we're going to making sure that we knock enter, close the door behind us to avoid any HIPAA violations. As I set my supplies here and have everything ready, I will come here and introduce myself to the patient. Hi, Miss Kathy. My name is Olga. I'm going to be your nurse today. The reason why I'm here today is that your doctor wants you to get an NG insertion. So I'm going to guide you through that. If I will follow and explain everything that is needed to be done. So we're going to go ahead and ask you your two patient identifications. Can you please verify your first name, your last name, and your date of birth? All right, perfect. That is great. So I'm going to go ahead here and hand hygiene, and I'm going to put on my clean gloves, and we're going to get started here. So I'm just going to prepare the patient. I'm going to go ahead and I will take the NG tubing and make a scar of that. And we're going to place this in a warm tub of water to have it all soften. Next, we're going to go ahead and make sure that this is ready at 30, sorry. 30, just so I can have it all ready. Next, we're going to go ahead and make sure that our patient is draped with a towel, and then also the drape under the over the patient's chest. As we have that ready, we're going to make sure that we open the lubricant to lubricate the tip of the nasal tube. Next, we want to go ahead and inspect the patient's nose, make sure that we're going to use our little pen light. So we're going to make sure that we see that there's no abrasions, the membrane is intact. We're going to make sure that we're going to see the nose where there's the most airflow, and it looks like we're going to be using the right side. Perfect. After we inspect that, we want to make sure that we get everything prepared. So next we're going to take out the tubing, and we're going to go ahead and we're going to lubricate the tip of this tubing, making sure that it's nice and tubed, just so it's easier to insert. We're going to discard that. Next, we're going to measure the tubing from the tip of from the nostril to the lobe, and we want to make sure that it's like at a curved natural side. So it looks like it's about at 15 or 10. Okay, next, as we have that, we're going to go ahead and we're going to have the patient at a high flowers position, and we're going to make sure that her bed is lifted up, and we're going to make the patient tilt her head back. All right, Miss Kathy, we're going to go ahead and start this procedure. So I'm going to go ahead and slowly insert it. Okay, perfect. And we're going to also make sure that there's a marking here to know where we're going to insert it, which I'm going to have it at 50. All right, so if she has got a gagging or she is vomiting, I have a water here for her. So I'm gonna have her kind of lean forward for me, and then we're gonna have you drink some water if you are gagging. Okay, perfect. And then I'm gonna have you take some deep breaths, and as she takes some deep breaths, I'm gonna insert it 2 to 4 inches in until I get to the insertion site, until I get to the marking that is needed, which is at 50. We're almost there. And we're gonna go all the way into her stomach. As we get into there is the marking. Next, we're gonna ask her, are you comfortable? You feeling okay? Give her some deep breaths in between, take any rest breaks, and have her water here. Next, we're going to go ahead and we're gonna secure with the tape, we're going to secure the tip of the nose here. So now that it is secure of the bridge of the nose, and then we're going to go ahead and also we're going to insert any orders of the doctor if needed. But also, I want to go ahead and I'm going to put this in, and we're going to go ahead and push in the solution here. And then after that, we will also examine to make sure that we're in the stomach. We're gonna grab some contact of the stomach fluid here, and we're going to put it in our cup here, and we're gonna measure like the pH, which is between 1 to 5. So we have our test strip here. We're gonna measure it. And we can also grab to see if we're in the right place by having an x-ray worker come by and check. And we're also gonna make sure that we clamp this, and we're going to place this on a patient's gown, or with a safety pin, which didn't come in the kit. So I'm going to go ahead and secure this to the patient's gown, and I am going to make sure that she is comfortable. I'm going to place her at a comfortable position, and we're going to make sure that this is all good. And we're going, after the procedure is done, we're going to make sure that we follow doctor's orders, and we go ahead and do what she needs, suctioning or feeding tubes. We're going to take off our gloves here. We're going to hand hygiene, and we're going to go ahead and document our results. So we're going to document how she tolerated the procedure, the marking of the tubing where it was placed at a 15 mark. We're going to make sure that we talk about the care that was provided. Did she vomit? And we're going to document the pH level, and we're going to document that she is comfortable, and the findings, if it was in the correct spot, how she tolerated was just in general, and the timing of the procedure. And that's about it. Thank you.